Welcome to Module 4, where we will discuss the regulatory environment for conducting telemedicine in the state of Texas. The learning objective for this presentation is to apply the best practices for live telemedicine within the patient-provider relationship. This module will provide the latest information regarding elements that must be met by providers in the state of Texas to comply with current regulations. The content has been designed for a clinical audience with minimal exposure to telemedicine. Although there are exceptions for telehealth, as discussed in a prior module, most telemedicine is conducted by a physician or other healthcare professional under the guidance and supervision of a physician. There are specific rules for who may treat and bill for certain encounters and procedures, so these must be noted before the visit. In Texas, as of 2018, Senate Bill 1107 opened new pathways to telemedicine. The patient-provider relationship must exist for telemedicine to occur and can be established in three ways: a pre-existing relationship, through video conference, and by telephone with access to a medical record. Before we go any further, when we integrate technology into healthcare, it should never be used as the solution to all, but as another way to communicate with your patients. The technology is used as a vehicle to bring the patient closer to you when they are at a distance. Care delivered through telemedicine should be the same quality as an in-person visit. The clinical standard of care must be the same. As covered in the previous module, obtaining an informed consent is necessary by state or local regulations. To reiterate, in Texas, to comply with state occupational policy, it is advised to have a separate consent for telemedicine services aside from the consent for treatment. The consent must be obtained through an authorized individual such as patient, parent, or guardian before telemedicine medical services or telehealth services are provided. More about this can be read in the Texas Occupations Code 111.002. In accordance with Texas Occupations Code 111.007, a practitioner who provides telemedicine should also be able to provide guidance on follow-up care. As we have covered, providers are required in certain cases to provide the patient's primary care physician with their treatment summary within 72 hours, with the exception of mental health services in a non-school-based setting. This treatment summary could include the patient's medical record or the report itself, with the rationale behind the recommended treatment, as well as a comprehensive write-up to include their evaluation, analysis, and diagnosis. With the developing public health pandemic, COVID-19, mitigating measures to slow the spread of the virus were adopted early on. In Texas, Governor Abbott responded to the growing need to mobilize healthcare professionals. And on March 14, 2020, the Governor of Texas and the Texas Medical Board temporarily suspended Texas Occupational Code 111.005 and Title 22 of the Texas Administrative Code. It is the opinion of the Texas Medical Board that in temporarily waiving these requirements, that Texas physicians, physician assistants, and the broader healthcare professional field are better able to direct their focus to treating patients across the state during this critical time. More information can be found on the website tmb.state.tx.us. As the Texas Medical Board continues to evaluate regulatory statutes, it has notably broadened procedures which affect how a physician-patient relationship can be established to now include the medium of telephone only. Phone consults are also now able to be used for diagnosis, treatment, ordering of tests, and prescribing for all conditions. Also, for all providers seeking renewal of licenses, the Texas Medical Board has made providers aware that their circumstances in lieu of this public health event will be considered. Furthermore, in hopes to allocate physicians to help combat the disease, the Texas Medical Board, along with Governor Abbott, approved a fast track for temporarily licensing to out-of-state physicians and other healthcare workers. The rules for prescribing are more stringent through telemedicine, however. While e-prescribing routine medications is not an issue in Texas, there are two specific treatments for which telemedicine is not allowed: treatment for chronic pain with scheduled drugs, or prescription of a drug or device that terminates a pregnancy. As treatment for opioid use disorder continues to be an issue in rural areas, the law regarding Schedule III controlled substances such as buprenorphine and Suboxone may be changing in the near future. Next, we will discuss administrative considerations. It is a good rule to have standard operating procedures or protocols surrounding roles and responsibilities of staff as well as hours of operation, what to do after hours, how to communicate with the physician and staff, and how to have procedures for emergency issues. It should go without saying, but bears repeating, that agreements must be in place to assure licensing of all physicians and practitioners, and also a systematic way to authenticate patients. Ideally, patient-provider identification should be done during the beginning of a telemedicine session, which would include the name and credentials of the provider and the name of the patient, the location of the patient during the session, immediate contact information for both provider and patient in case the session is disconnected or the signal is lost. You should also clarify the expectations about any contact with the physician between sessions. In summary, we reviewed recommendations regarding current regulations for the state of Texas and best practices for prescribing and establishing the patient-provider relationship.